Hi there, I'm Dr. Marnie Fisher.
And I'm Dr. Elena Poulos.
We're from Kingsway Dermatology and Cosmetic Center. And we'd like to introduce a topic to everybody concerning the skincare if you're an athlete. And it's important if you're athletic and you have a busy sweating routine and you need hydration and nutrition. Obviously, you probably know that. But what are the nitty-gritties regarding, say, chafing? If you get a blister, how should you take care of that maybe?
Well, and the reason we wanted to talk about this today is that really there are some specific changes that happen to the skin in athletes. And obviously it's going to vary a little bit depending on your sport and your particular skin type, but we can sort of try today to hit a few different topics and help give you advice on how to tackle it. Okay, so first, let's talk about excessive moisture. Most people that are athletic, they're going to work out a lot, they're going to do their sport or working out at the gym, they're going to have a lot of moisture, right? So scalp, face, torso, armpits, in the groin, in the feet, moisture. So what happens to the skin when there's excessive moisture?
So there's a phenomenon called maceration, and what happens is the uppermost area of the skin gets wet and stays wet. And when that happens, the skin can actually swell, and the micropores or the microostia and openings can swell closed. And that can produce a little bit of irritation. It can produce folliculitis, or frankly, any of the itises in...
Like the heat rash that you hear people
heat
talking
rash,
about?
Prickly heat is one of them.
Yeah.
So you can actually get a rash because your sweat glands are so blocked that they don't actually then exit the sweat onto the skin.
Exactly.
So it's like it's a bit of a catch-22 almost.
Right.
Yeah.
And so the solution for that, it's pretty simple, honestly. So if you've had your workout, you played your sport, you've had your practice, you get home, or even maybe if you're lucky enough in the change room, have a quick little shower, right? It's literally as easy as that. Cooler water, rinse it all off, help bring the body temperature back to normal. That'll help stop the sweating, and then obviously you dry yourself off. The other issue that happens when there's a lot of moisture is that people actually become prone to getting infections. So particularly in areas where the skin is folded, so women can get it, for example, under the breast, you can get it in the groin, you can get it in, between your butt cheeks and the back, sometimes even behind the ears. You can get infections from that excessive moisture. And there's different types of infections. So yeast infections are quite common with an organism called Candida. It looks almost like there's small little pimply bumps in the skin. It can be easily treated with an antifungal cream or an antifungal kind of lotion. Sometimes people will need oral medications if it's really severe, but that's one possibility of an infection. Others, we call it seborrheic dermatitis. So there can be an overgrowth of an organism called pityrosporum. It can happen in your scalp, in your ears, in your eyebrows, any hair-bearing areas, even on the chest. And that can cause redness, scaling, flaking, dandruff-like symptoms on the chest. You can even get folliculitis, so it looks a little pimply. Different type of infection. That one there is really nicely treated with some of the typical dandruff shampoos. So they have ingredients in there that are really targeted to that organism and can help.
On that note, there's pityriasis versicolor, which is a rash that comes up, sometimes noted only after a big dose of sunshine. So the bloom of the yeast has been sitting on your skin, usually on a V-neck distribution on your neck, chest, and on your back.
Upper arms and shoulders.
Upper arms and shoulders. Yeah. And it's called versicolor because it sometimes shows up as a pink rash, a white rash, or a brown rash. So it has different variations on it, but it's little spots and little ovals. And sometimes you see the affected area remaining whiter, and then the non-affected areas getting tanned in that first dose of sun in the summertime. So we get a whole slew of patients asking us, what is this rash? It's June, I wanna be outside, and I feel so self-conscious.
Yeah.
So very effective treatments for that. So
yeah. So again, from the moisture really, and I think the key, right, is A, identify there's something going on, B, get yourself seen by a dermatologist if you can, get on the proper treatment. But ultimately just understand that it's really from this excessive moisture. So you do what you can. So rinse off as quickly as you can. There's things like Botox for hyperhidrosis that we can do. So certainly for some people, we're just having a simple shower is not enough. And they're really sweating so much that these skin problems like the maceration, the infections are happening regardless. So for some of those people, doing Botox injections is a really nice way of treating it.
Yeah, I'm a big believer in picking the right clothing, which is to say the clothing needs to fit tight enough that that double weave, dry weave can then take the sweat from the surface of the skin and
the wicking
exit
part of it,
exiting it to the surface, and then it's evaporating, which is doing what it's supposed to be doing, and then therefore helping the skin. So that's very important with undergarments for sports as well as overgarments for sports. Yeah.
Well, and then let's talk about overgarments, right? So I don't know about you, but I've certainly seen a lot of hockey players, for example, over the years, right? They're wearing their helmet, they've got their chin pad, and sometimes like they'll come with like acne actually, right? From the constant rubbing of the chin pad or on the forehead. I mean, I remember seeing, I had a soccer player once that actually developed a full-on fungal infection because of the shin pads, right? So the shin pads were right up against the shin. There was sweating all the time, and actually I don't think that those shin pads were ever washed.
Oops.
Well, it's hard to wash.
Yeah. Well, on that note, my son plays football, and they have these athletic wear where the pads come out of the pockets, and then everything gets washed separately. So maybe that's happening with other sports as well. So maybe that's a progressive improvement.
Yeah, well, that's great. I mean, and I think that's really just something for you to think about, right? As you go through your athletic endeavors, right? If you're wearing equipment, it is really important to try to clean it as best as you can, right? So not everything has removable pads, but certainly if you can, cleaning it is a great option. A little bit of dilute bleach, a little bit of vinegar will help, alcohol, whatever you can do to just try to clean that surface and reduce the amount of bacteria, yeast, and fungus that's sitting on the surface will help.
Well then, okay, that's a good segue to what about feet? Because feet certainly do sweat a lot.
They do.
And then there can be the dreaded athlete's foot. What is athlete's foot?
So athlete's foot is what we call tinea pedis, which is really a fungal infection of the feet. And usually it starts sort of in the toe web, so in between the toes. So as the toes are pressed together, the moisture really kind of holds between those toes. And then you start getting this fungus growing. Usually, actually a lot of people have it, they don't even realize it, but you just spread your toes together, and if it looks like there's an open sore or the skin kind of looks a little bit white, it means that you have it. And there's certainly a lot of over-the-counter creams now that you can buy to treat this fungal infection. And it's really an issue, again, of excessive moisture, right? So if you get it and you don't want it, you've treated it, you don't want to get it again, it's really paying attention to how much moisture there is on your feet. So when you get home, take off your shoes, take off your socks, maybe have a quick shower, make sure they're really thoroughly dry.
Drying them out for sure, yeah. And then there's wearing your slides in the shower. Trying not to go barefoot.
Warts. Are we going to mention warts?
Oh, no.
Yeah.
Trying not to go barefoot as much as possible. And there's a lot of sports where you're barefoot. Gymnastics, dance, martial arts. It's a tough one. So look for it and treat it early.
Yeah. Well, with the athlete's foot, but also plantar's warts you can get, right? From running around without your shoes and socks on. And so it's the human papillomavirus. It can live on mats when they're not cleaned, right? If you're a gymnast or a dancer, you know that no one's disinfecting those floors in between those classes. So if you can, wear the yoga socks. If you can't and you're going to be barefoot, that's fine. Again, have a little shower, rinse it off. It'll decrease the likelihood of getting warts. And then certainly, there's nothing that beats inspection every now and again. So you should take a look at the bottoms of your feet. And if you can find a wart and you see one, it's very early on, the over-the-counter stuff works great. The problem really happens is when people aren't paying attention, and then all of a sudden, they've got many warts on their feet, or they're huge, and then they become much more challenging to treat.
And very painful. They can become very painful.
Very painful, yeah.
And limiting the sports activity. Yeah.
Well, you can, but people love their sports.
Yeah.
Okay, let's talk about swimming, because that's the other one, actually. There's a lot of swimmers, just from having their skin in the chlorine a lot, they can get difficulties. And actually, I would say one of my biggest challenges as a dermatologist is treating the teenage competitive swimmer who also has acne.
Yeah, that's a challenge.
It's a tough one, right? The chlorine is very irritating, so often they're dealing with already sort of a chafed skin from the many hours in the pool, and then at the same time they've got their acne, so you're trying to treat their acne without irritating their skin and getting their skin even redder.
I usually try and encourage some oral medications in that case because the oral medications are working from the inside out. and then we can just concentrate on moisturizing skin on the surface.
Exactly. And there are a few like niche acne topical products as well that are not bad. They mainly work as anti-inflammatories and they're not quite as irritating, but there's really only a couple of them on the market that are not going to irritate the skin.
I also find it's not just the chlorine or the bromine in the pools, but it's the actual pool temperature. So a lot of the pools are not kept at a competitive rate because they're also used by some of the older adults in the communities who want the pool a little warmer. So that is a challenge as well. So having that wet, dry, so when you're out of the pool and the water instantly evaporates off the surface of your skin, it has that, again, that wicking effect, but it can over dry your skin. So it's very important to clean the bromine
quick shower
and put the moisturizer on immediately when you're out of that pool.
Yeah, and sometimes like the oil-based cleansers are actually really nice for swimmers because that way they can clean it without over drying their skin. So, and then segueing right into temperature, other temperature related things. So then we have the other extreme, which are people that are training out in the cold all the time, right? So your skiers, people, well, skaters I guess can do it, can get it as well. So that cold exposure. Any tips for the cold people?
Well, not, I would say, for maybe skating and skiing because they're so athletic that they actually warm up. But the one thing, do you remember from dermatology and medical school, which was horseback riding and cold? So there was a cold-induced fat inflammation on the sides of the thighs of horseback riders when they were riding around in the wintertime as a distinct phenomenon, which may have been one of the original ideas behind cool sculpting.
Yeah, that's true. So,
serendipity.
Serendipity, that's for sure. So cold exposure is actually will kill fat.
Yeah, so it's very important to see those wind chill factor areas and protect them from...
Exactly, and just to pay attention to it, right? So sometimes I feel like, you know, people are really into their sports and their mind is so focused that they may not notice, for example, that their thighs are really cold, or for example, your hands. So if your hands are getting repeatedly exposed to this cold, it's a risk factor for developing diseases like Raynaud's, which is like a vascular instability of your hands, and over time can really be detrimental. There are also other kind of these very unusual skin conditions like cold-induced urticaria. So that's a condition where people get hives all over their body from being induced to cold. And so it is really important that as you go through, you know, and obviously you're focused on your performance, but pay attention to the effect that that temperature is having on your skin.
So that's cold. And then what about excessive heat? Like let's say you're playing tennis and it's the summer and it's 30 degrees.
So again, like the sweat things that we've already talked about and all those infections and the heat rash that you can get, you know, it's really important that you're hydrated really well so that you don't actually feel sick.
Yeah, heat stroke is very dangerous. So very important to keep up on those electrolytes and liquids for sure.
And then let's not forget that sun, obviously, right, for people that are doing outdoor sports and activities is a major thing, right? So whether you're a runner, you're a cyclist, you just like going for long walks or swimming at the lake. So sun protection. So what are your top tips for sun protection?
So my top tips is to not have any barriers or obstacles, to wearing clothing when you can, because clothing is a much better sun protectant barrier than the physical
Sunscreen.
Or the absorbing sunscreens.
Always,
yes, exactly.
always.
So there's neat little sleeves that you buy and they go from
for the
here to
golfers,
here.
right?
Golfers, tennis, paddlers, runners. There's shrugs, there's hoodies, and there's gaiters that you can buy that go on your neck and then you pull them up when necessary and back down. You see that mostly, I would say, in fishing, if we have any fisher enthusiasts out there, or water sports enthusiasts. That's a big one as well. It's interesting how a lot of the sports are borrowing other sports gear from other sports if they can't find it within their own too, which I love. I love to see that.
Yeah, I mean, I agree with you. And I always kind of tell people, and even people that have had scares, right, like melanoma, right, you should enjoy your time outdoors, do as much of that as you can. It's obviously healthy for your lifestyle, but protect as much from clothing as much as you can. Like, I love swimming, I love being at the ocean, I love it. But for me, I'll throw on a rash guard, right? So those are those swim shirts, right? High collar, long sleeves. I mean, yes, I'm going to do the sunscreen, but I know that especially if you're in the water or, you know, you as a golfer and you're sweating up a storm, right? The sunscreen is going to last, but you got to keep on reapplying it. And most of us, you know, when you're enjoying yourself or let's say you're in a competition, you're not going to stop and reapply your sunscreen. Whereas if you can find clothing that suits you and that you enjoy wearing, right, it really goes a long way.
The other sport that might not think about wearing sunscreen are the sports where you go up into the elevations. So the altitude brings you closer to the sun, and you could be in British Columbia, in Alberta, in the Rockies, and it's like you're right down there at the equator or even closer. So it's very important with the sun shining right off the snow and the ice onto the bottom of your face.
Oh yeah,
good. Yeah, so
well,
you
for
need to
sure,
do down here, even under your nose. I've had patients with basal cells inside their noses who were avid skiers.
Yeah, so the skiers for sure, right? The adventurers that are kind of going hiking and are at higher altitudes doing it, they're a huge risk.
Yeah.
So I hope that provides like a little bit of an overview and an oversight, and certainly there's a lot that can be done, and obviously we want everybody to enjoy their sports, but paying a small little attention to your skin and the way that your sports and your activity affects you goes a long way. Thanks for watching. We'll see you at the next video.